Okay, let's talk about hyperaldosteronism today. Let's do a quick definition between primary and secondary. So, primary hyperaldosteronism is just elevated aldosterone or increased production. And the cause of the primary can be adrenal hyperplasia or adenoma, or it can be carcinoma. Out of these three, hyperplasia is the more common one, versus secondary is usually due to another problem. So secondary can be due to like increased RAS activity. So etiology for that can be renal artery stenosis, or it could be heart failure, cirrhosis, or nephrotic syndrome. Or there's a rare disease which is called JG renin secreting tumor. So this basically just a glomerular renin secreting tumor. Okay, so let's talk about the clinical findings. So when you have increase in aldosterone, you're going to have hypertension, you're going to have hypokalemia, you will have metabolic alkalosis, and you can have mild hypernatremia. Okay, and how can we diagnose? First one, it's you can see elevated aldosterone renin ratio, which is usually over 20. If that's elevated, we need to do an aldosterone suppression test. If that's negative, then it's alternate diagnosis. Okay. If it's positive, we need to do adrenal CT. If you see bilateral hyperplasia on adrenal CT, you need to do adrenal venous sampling. Or you can have on CT, you can see unilateral, and it's usually adenoma if it's unilateral. In treatment, if you have a unilateral adenoma and hyperplasia, do surgery. If it's a bilateral, we treat with spironolactone or eplerenone. Okay. And that's about it for today's video.